And now we have Meg from pathology.
So treat others as you would have yourself be treated. This is the golden rule we probably all heard as kids, but it's the opposite of what we're looking to do in precision medicine. Precision medicine is the idea that we should tailor therapies to individual patients. And this is actually a really important concept for treating cancer because no two cancers are the same. We actually already use precision medicine when we treat breast cancer, which is what I study. So one of the first things that happens when someone is diagnosed with breast cancer is they come into the clinic and a tumor biopsy or sample is taken. Doctors look at the sample and they assess how aggressive the tumor is and how it should be treated. What the doctors are looking for are specific markers or a genetic pattern that tells them what drug the patient will respond to. And we're getting really good at determining which drugs the patient will respond to from our existing drug panel, but what we don't know is how to work precision medicine into developing new drugs. So what I'm working on is a situation on the left where we have a clinical trial with 3 breast cancer patients treated with a new drug. 2 of them don't respond. The cancer progresses regardless of the drug treatment. But in one of the patients, they actually have a really good response to the drug. But if you're just going to look at this clinical trial, overall, on average, maybe the drug has a mediocre effect. So what I'm trying to do is to determine which patients will respond to a new drug before they're even given that drug. So to do this, I've genetically manipulated breast cancer cells. And essentially what I did is I turned genes off one at a time for 10,000 genes. And through this I could tell by turning certain genes off if that had an effect on how the cells responded to my new drug I was looking at. With this I built a gene-based responder signature, and I'm trying to test this in actual patient samples. So there are breast cancer patients around Halifax who donated samples of their tumors, and I looked at these samples to see if any of them had my responder signature I was looking for. And some of them actually did. So I took these samples, I put them in mice, and then I treated those mice with my new drug as if they were that patient. And the tumors responded to this new drug. So this was really exciting, and so I'm working on patenting this responder signature. Hopefully, this will lead to better clinical trials involving this drug, and will also encourage other researchers studying different cancer drugs to use a similar approach in developing more responder signatures. This should increase the clinical efficiency of getting drugs out to patients and will prevent the waste of time and resources that it takes to get a drug to this stage where you see the mediocre response, where you could have just stratified or separated your patients out into responders and non-responders before you give them that drug. So my hope is that this will help breast cancer patients and get them the most efficient, best therapy possible. Thank you.